Call this meeting to order. We get a roll call vote, please.
Mayor Larry Milton.
Here.
City Administrator Kathy Stepp. Here. Alderman Chuck Rodriguez.
Here.
Kevin McConnell.
Here.
Lane McConnell.
Here.
Mayor, we have a quorum.
Thank you.
Sorry about that.
Are you watching the video?
I hit the button accidentally. My bad.
If you're ready, Jen, we'll start off with a report from you regarding, oh, I apologize. Is everybody on the board read the committee minutes from the October 19th meeting? If so, I'd entertain a motion to approve.
So moved.
We have two motions, no seconds. All in favor, say aye.
Aye.
Opposed, same sign. Ayes have it. Now we'll move on to Jan. Jan, what do you got for us this
All
morning?
right, Mayor. We're going to start out first and foremost with promotions and transfers. Officer Greg Yartz was recently promoted to sergeant. He's been with us for a few years, and we had a vacancy with the departure of Chris Higdon, and he moved into that role. Shane Randall left the organization, and we've hired Ethan Forrest to be our equipment operator. And then Sheena Simmons transferred over to the fire department after working in administration for the past 5 years. Our new hires are Alex Gerard, who is now our assistant to the city administrator. Harold Brown is a plant operator trainee who replaced Dustin Carfield. Dustin Carfield moved over to a different role. We've got Landry Gossrand, who is now one of our new building inspectors. And Michelle Tucker is our new utility accountant who replaced Philip Parsons.
Glad to see these reports are back at our meetings. Thank you, Jan.
Yeah.
You have anything else you'd like to share with us this morning?
That's it for now. That's, I guess we can wrap it up and call it
Take
a
a
day.
motion to adjourn? You sure you don't have anything else?
Let's come up with something, I'm sure. All right. I'll tell you what. All right. I want to present today the offering for medical insurance that the insurance options that the city wants to provide for its employees for 2023. I'll just read through this. Earlier this year, city staff discussed with the Board of Aldermen a plan to issue an RFQ for brokerage services related to medical insurance. The current broker requested it be changed to an RFP for insurance coverages, and then that the broker bringing the best option to the city would then win the service or get the agreement with the city for brokerage services for the following year. The RFP asks for options on fully insured, partially self-funded, and fully self-funded medical insurance plans. After we went through and reviewed those, there were some issues with respect to submitting all of the information on time. Our current broker was not able to submit all of their information by the deadline, so based on that, we decided to do a best and final offer, have all the brokers who are competing submit their absolute best. Let's cut to the chase, let's get it down, and let's move on. And after we did that, we had offers from Hollis Acres and Arney, Connell Insurance, Navant, and JTS Financial. What ended up happening is we had one broker submitted 6 entries, many of which were very high in price. We had one broker that submitted only 1 entry. We had another broker that submitted 2, and another one that submitted 3. all that being said, JTS was the one firm that ran all of them. They ran a fully insured plan, they ran a partially self-funded plan, and they ran a a self-insured plan. And with that, is Ben on the line at this point?
I am.
I will let Ben take it over from there.
Good morning.
Morning, Ben.
Hopefully you guys are doing well on this cold morning. Jane gave a pretty good background to where we started. What I'd like to do is just touch on some of the overall city costs. This is not from an employee perspective. I think he's going to pick it up from there and talk about employee perspective when I get through a couple of slides. I'm going to try to make this as simple as possible, really. So for the Board of Aldermen, when we take it to them, the current cost, the slide shows the current cost we pay. You can see the total number of employees, the no.EEs, total number of employees per plan that we have, and then the cost on each one of those plans. In 22, it's around $3.5 million in those in costs, and that's the current year that we're in. When we go annually to get any kind of renewals, we usually get an estimate or a quote from a broker on what that increase might look like. And 10% or above is what we're seeing typically in the market for increases. And they can go up from there depending on the exposure and the risk and claims that we have for each one of those plans. But when we reached out to the broker and received our quotes for this coming year in 2023, you can see on the left-hand side, the First Anthem increase percentage amongst the plans, 9.9% even. So it's just under a 10% increase, and that annual increase is around $347,000. Now, they went back and took a look at it and was able to get that down to a 7.43% increase, but it was still a fairly sizable increase in premiums or in cost for insurance for 2023. Now, within the budget, we've got I think we've got 10 to 15% built into that budget for 2023. So Jan said Aetna was our top candidate. This is the Aetna cost that came back with JTS, and this is the level funded plan. And he had mentioned the fully insured, the level funded, or the self-insured. They had bid each one of those. And all we did was just purely compare costs amongst the plans themselves. And in this case, the three plans that are available, we've got 2.5% increase and 2% increases on the ones that are at zero deductible. On the first and third plans. The second one is a little richer plan in deductibles, the 4.6% increase. Obviously, all three of those are lower than what the second offer was for the Anthem plan. So this annual increase is around $24,000 amongst the total cost. So 3.5 million, still not out of the 3.5 million range of what we're paying in 2022. If you compare that to what we've got or what we're facing if we don't do anything, we just sit tight, that 3.5 is what the recommendation is that staff's recommending to the Board of Aldermen. The first and second Anthem, you can kind of see the contrast there, the 3.8 million on the left-hand side in the blue, and then up in Aetna 3.5. So you can kind of see what those cost comparisons are. So that's really where we're at on total cost. What this does is allow the city to do a couple of things. It keeps the cost low, but it also sets ourselves up for the eventual self-funded goal that the Board of Aldermen discussed back in August when we were talking about that moving forward. The Aetna 2023 renewal proposal, it does act like a fully insured plan, but it's sitting on a self-funded chassis. In other words, we're really limited to the exposure to the premiums only, and not anything else. The data will be available, all data will be available at the city's discretion for future renewals. So we'll be able to tell what our exposure is and how much we need to set aside for self-funded in 2024. It does have significant increase in the employee benefits, and I'll let Jane go through that here in a second. Overall cost for the city will drop in 22, which is one of our goals. It increases based on solely on the lowest max out-of-pocket cost. So in other words, the lower out-of-pocket cost receives the higher premium. So it's pay to play, if you will. It's not even across the board. With a zero deductible, you'll have a lower premium, and the estimate is for the city. It'd be surprising if users don't gravitate toward that higher max out of pocket, since there's no deductible at all with it. For a self-funded, what that looks like in the future, we do have carryover budget of $100,000 from 22 that will carry over into 23 and set that aside. We've got around $400,000 carryover budget anticipated from 23, and this is going to really be around the savings of what's already built into the budget and moving forward with a plan that doesn't cost as much with the same or better benefits. I'll add that caveat there. So the overall amount that would be available without contributing anything else for 24, just to kickstart a reserve for a self-funded, is around $500,000. So based on claims and what we have experienced, we'll be able to go through and look at what the first 3 to 4 months are in order to study that activity and see what that 2024 overall cost might be, or what that reserve needs to look like when we move forward. This slide shows the current level funded plan on the left, and that's our current recommendation, and what the possible 2024 self-funded might look like. This isn't unusual from what we have experienced in the market, at least. When we control our own claims, when we control our own future with premiums are concerned, it usually levels out the cost itself. This one, JTS is looking at an 11% decrease. This is based on, I believe, 3 years of data that they've been able to accumulate through other RFPs in the past. So we would basically scrub these numbers this spring and summer and be able to start talking about what 2024 looks like, and eventually get to that self-funded goal. And this actually might show up on your screen pretty small. All this is just a comparison of what we have today and what is in the plan itself. The biggest piece really is in the middle on the right-hand set of boxes where all the zeros are. Usually there's a copay related to a lot of those. In this case, there's no copay, no deductible. And with that, I think I'm going to turn it over. Well, yeah, I'm going to turn it over to Jan to kind of follow up on the overall benefits. Jan, you want to take it from here?
Okay, sounds good. And just to be clear, the one thing that I put together, some of the clips from the spreadsheets that Ben showed there, I labeled things as Aetna. And the reality is, it's going to be gravy. It looks like gravy, but it's pronounced gravy, like biscuits and it's truly a self-funded platform whereby Gravy is managing all the pieces. They are simply renting the network from Aetna to be able to use that so that we can have greater employee benefits and healthcare access and things like that. So, Brendan, if you would, bring up that other presentation. Okay, I want to talk about the employee insurance with Gravy. Our options, we have 3 plans like we had before. We've got a buy-up plan, a base plan, and a traditional HSA plan. The buy-up plan and the base plan are going to be uniquely different from what they are right now. the HSA, the IRS kind of dictates how those act and behave and things like that. So we're not going to see much of any change at all in the HSA. The deductibles, we're going to have 2 different zero deductible plans. And, that's, for a dramatic effect, that's not a typo. In the past, it was $1,000, or currently it's $1,000 deductible, meaning employees have to first pony up $1,000 before they start applying co-insurance and things like that for things that aren't particularly covered directly. The city, we anticipate, primarily because of the lower price of that base plan, the city should see a $77,000 savings over the current year. 61% of the employees, those employees in the zero deductible, the high max out-of-pocket, and the HSA, those employees will see lower premiums. 77% of employees will see significantly reduced costs for direct medical care, to include $0 copays, $0 generic prescriptions, and a lot of other costs that are going to be just zero. Things like imaging, blood work, urgent care, all of those doctor-type visits, zero cost to the employee. And the big one for us is options. Cox and Mercy will now be in-network. Employees, they are not going to be saddled with only going to Cox facilities and things like that. Currently, some Mercy doctors are in the Cox network, but this opens it wide up to, that way the Mercy facilities are also going to be in network as well. Traditional zero deductible users, where they have the $1,250 max out of pocket, effectively all they're going to do is pay $1,250 and they're going to be done. But they are going to see a 4.6% increase. Traditionally, whenever Anthem would apply rate increases, they would spread the pain across all plans. They would say, this plan gets this, a 7% increase, this one gets a 7%, and this one gets a 7%. The way Gravy is looking at it, the way they apply it, is we're looking at those where the usage is the most intense. 70% of our employees use less than $2,000 a year in medical insurance, or in medical claims, and 60% have less than $1,000. So the natural progression in my mind is going to be a lot of our employees are going to migrate over to the higher max out-of-pocket zero deductible plan, and they won't be hurt at all. They will see reductions in overall costs. But, if I'm somebody who's planning a surgery or something like that, I might want to choose the lower max out-of-pocket just to cover my bases. I'm paying a little more in premium, but it's not that much more, but yet I get good coverage. And again, the $1,000 deductible plan will drop to a $0 deductible, and there will be a 2% rate decrease for those folks. The HSA users will see reduced rates with the same benefit. They'll see a little over 2% themselves. But in my mind, the biggest piece of this is this puts the city on a clear path to being self-funded. All of these elements are currently on a self-funded platform. The reality is all we're doing at this point by doing a partially self-funded is we are hedging our bets. We are limiting our overall risk so that we can set aside money, and that way we can be ready for becoming fully self-insured in that respect. Last year when we were talking about it, going through this process, for multiple years I've been a big proponent of the city going self-funded on its insurance. But last year the board and the HR committee said, let's take a conservative approach. Let's look at partially self-funded first so that we can stick our toe in the water and see how it feels. That's what we're doing here. This was, from my chair, this was one of the best options I've seen. You know, now granted, the self-insured option was a significant savings, but again, that assumes that the city would then take the risk without having all the funds set in place to prepare for the worst-case scenario. And, you know, with that being said, you know, I think $500,000 set aside for a fund like that puts us in a good footing to become self-insured. I want to do a little comparison contrast with respect to, you know, the buy-up plan. You know, the deductible on the current plan is 0, and the new gravy plan is going to be 0. There's 20% co-insurance. There's no co-insurance with the gravy plan. Effectively, what you do is you're paying your max out of pocket. Like if you go to the hospital or something like that, you're going to pay that $12.50 up front. You're done. $30 copay for doctor visits on the current plan, 0 on our gravy plan. And you can see those. Specialists are 0, urgent care 0, lab work 0, imaging 0. These are the things, these are the items that most of our employees will use on a day-to-day basis. They'll go to the doctor, $30 normally. This way, doesn't cost anything. They're just, you know, it goes through that process for all of those, all of the PPO plans that we have. The generics, generic drugs, I should say, 0 cost for generic drugs. Now, when you look at the preferred brand, you know, the adage is if you see it advertised on TV, it's expensive. And that's why those rates go up. Now, the gravy plan for the preferred prescriptions is a little bit more expensive. However, it's structured in a way to give employees at that level are typically needing larger quantities and things like that, but it's structured that allows them to have a 90-day supply. The non-preferred actually ends up being a better value over a 90-day period simply because you're saving money versus what our current plan would be. And then the specialty RX, those formulary pieces where a doctor may prescribe, you know, the pharmacist to grind things up and whatever, those are the things that are going to end up being less expensive for our employees. The max out-of-pocket, the ER. ER copay drops from $300 to $250. We had set the ER copay to $300 several years ago, primarily because a lot of our employees were using the emergency room as their primary care physician. And anytime you go to the ER, you're typically looking at anywhere from $1,500 to $2,500 billed against our plan. And that helped eliminate that. So we want to start, you know, we don't really have that problem anymore, so we want to back that off and give that opportunity for employees to save a little money if they do have to go to the emergency room. 20% copay on the current plan and 0 after the max out-of-pocket is reached. And again, Cox only in network in our current plan, and Cox and Mercy in network under the gravy plan. The base plan has all the same elements as the buy-up plan. The big difference is going to be the max out-of-pocket is going to be about $1,500 more. But again, I go back to the premise that 70% of our employees use less than $2,000 a year. Most of the people on this plan aren't even going to hit the $2,500 max out-of-pocket on the current plan. And so that additional room, assuming that the employee takes on a little more of the risk, that enables those rates to go down. The actual percentage goes down a couple of percentage points. And again, Cox and Mercy are both going to be in-network provider. The high deductible HSA plan, again, $3,000 deductible. Everything acts and behaves the same as it currently does. 0 cost after your deductible is met on everything. But the one difference is there is Cox and Mercy and Network. Premiums. As you look at this, it's kind of small to see. It gives you all the tiers there. You can see that the way it's structured, the $4,000 max out of pocket, the employee saves money on that for the individual employee on tier 2. Now, let's be honest, on tier 1 on the base plan doesn't cost an employee anything anyway right now. So whatever savings there is goes directly to the city. But it is not insignificant when you're looking at $16.79 per employee per month. So it's a nice savings. The only real downside for employees on this is that with the HSA, since the premium of the base plan has been lowered, that matching amount to make good on the HSA contribution has been lowered too. It's been lowered from, I think it's about $83 per person per month down to $75 per person per month. The employee spouse, again, the base plan, employees will see a drop in that. The city will see a drop on all of those plans as well. Employees are seeing a reduction of about $2.51 a month on the base plan and $1.83 on the HSA plan. There is an increase on the buy-up plan. And employee children, similar scenario there. When you look at our offering, we typically have, just as a basic rule of thumb, roughly 1/3, a little over 1/3 of our employees are on the employee-only plan. A little over or a little under 1/3 are on a combination of employee children and employee spouse, and roughly 1/3 is on the family plan. And so the family plan, you see, those prices are going to drop for employees as well. So we will have all of this information laid out and ready for the Board of Aldermen next Tuesday. So that being said, I will entertain any questions you might have. And I want to also introduce, I've got Joy Van Dyke and Charles Angel from JTS Financial. JTS Financial has offices in the city of Branson.
Welcome, Joy and Charles. That was a mouthful. And the first question that comes to mind, and I know I saw and heard what you just presented. What's the trade-offs? I mean, it sounds, in summary, the employees are going to pay less money. The city is going to pay less money. The benefits have all increased to the employees as far as their benefits from these policies. The only negative that I've heard is the max increase of $1,500 more out of pocket for the employees.
On the base plan.
On the base plan.
Yeah.
And the city, based on your assumptions, and the city will save roughly $400,000 in 2023.
No, I'm sorry, $77,000 in 2023.
Was it 400? Where did I see that 400,000?
That 400,000.
24? Okay, so 2024.
Yeah.
So this year, 77,000, the 400, how confident are you with your assumptions that the city will receive that roughly $400,000 savings in '24?
Our trend historically has been claims to premium ratios somewhere in the 74 to 77% range. That fits right within that.
So that's where that possible number may change depending on claims.
Yeah.
Right?
And the other thing that I am seriously remiss on in showing numbers here is the one thing I did not articulate is the possible refund that we could see in 24 based on if we have a good year in 23. You know, the reality is Gravy has established a point by which they established our rates. And that point is based on looking at our claims and increasing it by a percentage amount. They just kind of throw that in there just to kind of hedge their bets, if you will. So at the end of the day, that, you know, if we don't hit that mark with respect to our claims, they'll look at that and they say, okay, since we're partially self-funded, we look at that difference, that delta between what we used and what we paid for. They'll look at that delta and say, here, you get half of it back. Under a fully self-funded, we get it all back.
And the trade-off is, if our claims increase, then we're not at higher risk changing to this plan.
Right,
We just will receive less back.
exactly.
Wow. Is there anything we need to hear that we haven't heard? Any potential risk, potential downsides?
Charles, can you help me out with that?
Good morning. My name's Charles Angel with JTS Financial, as Jan went over before. Mayor, to answer that question, I could point at a couple of things. One, you've already pointed out, which is on that base plan, the $1,500 higher out-of-pocket max. There are some things that can curtail those risks, all the zeros that you saw up there with the other things. But if someone were to be inpatient in the hospital or have an outpatient procedure, they're going to hit that number. So, I mean, that could be a negative if they came from the base plan and stay on the base plan. You also saw on the preferred drug list, you end up with about a $5 a month higher expenditure there, which is not much. The other three tiers on pharmaceuticals would be less as well. That is about the only holes I see. I will say on the current $0 deductible plan, it goes to 80/20 coinsurance automatically, where they have to pay the full 100% of the $1,250 on that plan. So an employee could more rapidly get to that $1,250 out-of-pocket max on the new plan versus the old. But since the only thing you basically pay for on the health side is hospital and outpatient procedures, again, the likelihood of not hitting that number is slim. You'd have to have a very minor procedure to not owe $1,200 anyway if you were having a procedure done. So I'm not sure I really consider that a negative, but if we're looking at potential ways there could be a negative, I could point to that one as well.
So at 10,000 feet, Jan shared information that 70% of our employees have $2,000 a year or less in expenses annually. So the real difference is the 70% that don't have many expenses, claims, that's where the real savings is. And like Jan said, if there is any, if the employees have any family issues, medical issues that they're anticipating, then they would choose the opposite. They would choose the lower max out of pocket.
Yes, sir.
Wow. These are huge dollars. These are huge dollars for every single employee savings. Those zero deductibles for your doctor's visit, imaging, all those items, which I think would be more normal than most, that makes a difference.
It does, Mayor, and if I could, I'd like to point out something else. The reason this plan is designed this way, because Gravy also owns the reinsurance carrier, the stop-loss carrier. So they're taking these risks intentionally, because there is some risk there, because those are the things that are utilized the most often, imaging, lab work, things like that. The reason they're doing that, though, is betting on wellness. If it doesn't cost the employee anything to do the lab work, they're more likely to do it frequently, do it on time, and stop us from having a larger claim down the road, which is good for the city's plan and good for the employee's health.
Yeah, I can see that. Any questions or comments from the committee? Go ahead.
Just one quick comment, and because I've spent so much time on the HR committee over the years, except for the brief time where I was removed from it, Jan, this is something you've been talking about since like my first meeting. And the level funding piece, I just think is a stroke of genius because you're not going all the way to the full risk today. But as we said, that's on that chassis to move forward in the future doing that, which is going to, I think, bring real savings to the city and to our employees. So this is exciting for me. I feel like we've been talking about this for a long, long time. I know there have been various roadblocks and certain reluctance. With all these savings, it comes from somewhere. I don't want to, it comes from somewhere. And so I'm just excited and happy that this is a good first step to ultimately go self-funding, but it still protects the city. So great job.
Any comments, Kathy?
I do, thank you. I first want to thank all the different brokers that submitted their proposals through the process, and they were really good and patient through all of that. I especially want to give thanks to our team that scored the different proposals, to Ben, who was very helpful with his experience in municipal government as well, and looking at different plans and evaluating pros and cons. And I also want to thank Jan for his work over the years and his commitment to get us on that glide path, and I think it was really, really well done. Change is hard for everybody that's been involved, and we've had long-term relationships, that are changing now as we move forward. But I want to encourage everybody to really embrace that this is that moment in time where we can start to pivot now to the self-funded plan, and that can only be good for the city and for the employees, which is equally important. So my hat's off to everybody that was involved, and man, did I get a crash course education on health insurance quotes. So thank you, Jan, for that. I appreciate it.
Chuck, you have anything? Well, I think it sounds like we're leaning this direction.
Yeah, I'd say so.
$100 question is, we're sitting in the middle of November. The timing for the changeover, we're changing brokers and carriers. And this is in effect on January 1, I'm assuming.
Yes,
That's going to be a lot of chop.
it is. And you bring up a good point. When I bring it to the board next Tuesday, I will be asking for a double read simply because the limited amount of time. We've already done our pre-work with the other folks involved. American Fidelity, on their system, on their platform, they do our open enrollment for us. So we've got that planned for the first week of first full week of December, not the first week, but the first full week of December. I've convinced Kimberly not to have her baby until February. So,
Did you get that, Kimberly?
it will show up on our performance evaluation if it comes early. So, all that being said, we've got a good team at the ready. Charles and the JTS team will help us. They'll have advisors there. Joy will be here helping us through things. Steve O'Kane with American Fidelity, he'll be leading up that team. Even if we get to that point where we have to take paper applications for everything, we'll get her done.
Mr. Mayor?
Yes.
Jan, did you want to just talk quickly for the staff that are paying attention about our vision and dental as well in the path forward?
Vision and dental, those things, those are going to just, we currently had we are currently on the first year of a 2-year agreement with Delta Dental and Delta Vision, and we're just going to renew that option. It's a flat option for 2023, and we're just going to keep that the same. We will have our broker take a look at that in 2023 to see what options we have there.
Very good. Unless I've missed something, this doesn't require much discussion. This recommendation to the board shouldn't take much time either. I know we don't like double reads, but due to timing, this is important, although this is a huge step for our city. Wow. And it's like Kevin said, I've been on this committee for almost 4 years now, and we've been talking about this topic for the last 4 years,
Yeah,
moving to self-insured.
right.
Wow. Well, if there's no other questions or comments, is there anything else you'd like to share with? You don't have to because you shared really good stuff, so we don't expect any more. But do you have anything else you'd like to share with us today?
I do. You know, the two pillars of what I make no secret of it. In the next year or so, I'm going to exit off into the sunset and to go do other things to keep myself occupied. And that being said, the two pillars of things that I wanted to make sure I did before I left this organization is I want to make sure we go to self-funded, and I want to make sure we correct our pay plan or where we're at. My primary issue is that, you know, in a lot of respects, our pay plan was established in 2008 or 9, who knows when it was. And change, as the city administrator said, change is difficult, and it is like pulling teeth sometimes to try to get folks to change, and getting pay plans to change is a big one. I will say, to just start out, working with Ben Hart with Baker Tilly has been a massive breath of fresh air for all directors. It's just incredible, the freedom we now have to make suggestions and bring forth options for things. And the one thing we did for what we're, you know, for 2023 with respect to compensation is we looked at how will pay increases most quickly and easily affect employees. And typically what we do on pay raises is we'll do a cost of living increase on January 1st, and then on the person's evaluation date, which could be anywhere from January 2nd through December 31st, we give them a pay raise based on their performance. It's a sliding scale from 2.05%, 2.5% to 3%. What we decided to do with Ben's help and direction is we combined them all in one. We put all of that, and that's the thing. In the past, we had always budgeted 3% for pay raises for performance, but I see all the performance evaluations. I run the data on them. 12% of our employees get 3% raises. The rest get 2.5 or 2.05% raises. So that delta of that money in there was kind of rat-holed away for years. We weren't effectively using it. This year, we're going to use it all, and we're going to use it all on January 1st. That being said, every department, every employee in the city, full-time employees, are going to see a 5% increase effective January 1st. That being said, that's kind of the foundation of our whole compensation package that we have. The firefighters, we went through a process with those folks, with the IFF a few weeks ago, where and I'll be bringing that to the board for approval on Tuesday as well, where we looked at the current pay scale. The current pay scale has an entry-level rate, and then it has 20 steps thereafter. Our firefighters, their perspective, firefighters and police both, their perspectives are, I want to be able to get to the top of my pay scale as quickly as possible. I mean, these guys, they're great guys, but let's be honest, they've got a short shelf life as employees simply because the nature of their work. You know, they blow out knees, they hurt their necks and things like that. They're grappling with bad guys, or they're extracting people out of cars in precarious positions, they hurt themselves. And at some point, we need to make sure that we take care of them for their years of service. And kind of as a segue back to the self-funding part, that's another thing I'd like to be able to see us do, is offer an incentive, a longevity incentive for employees so that, you know, our firefighters and police officers, they can retire at age 55. That gap between 55 and 65, when you become Medicare eligible, that's a 10-year gap. That's significant. It'd be nice to be able to offer some kind of plan, some kind of incentive to keep them here longer through our insurance, that maybe it doesn't pay for the entire insurance package, but it helps. And that's what I'd like to do. But I digress. The one thing that we did with the IFF is we developed a pay plan that will go into effect January 1 of 2024. The pay plan is effectively, it's reduced from 21 steps to 10 steps. We just simply took every other step out. And, you know, instead of having a 2.05% increase between steps, it's going to be a 4.14% increase. So that way, whenever an employee, a firefighter, sees a pay raise or something like that, they're going to see a significant increase in pay from one step to the next, and they can top out sooner. So that being said, let's open up that first exhibit, if you would, on 2023 firefighter pay. This one is particularly boring.
Is this the one you're looking
Yeah.
for? Okay.
This is the problem child that we're fixing for 2024. This is where we have 21 steps. We've got the entry-level steps, and we've got then we have 20 steps thereafter. This is where we are going to, for 2023, we're bumping this across the board by 5%. And that's where, for 2023, that's where the firefighters get their pay raise. In 2024, they will be replaced in a truncated pay plan. And my goal is between now and then to hopefully establish a similar plan for the police officers as well. Okay, let's look at, if you would, Chad, the next one, the classified pay matrix. And if you could just zoom up, if you would, please. If you look at that, you see the, let me back up just a little bit. Kimberly Cooper did phenomenal work on developing this. She was the main driver behind all of this. She met with the department heads. She crunched all the numbers. She did everything. She passed things by me for review, and I didn't have to make too many changes, you know, so she did fantastic work. So my hats are off to her for this enormous amount of work she did. So that being said, you look at this particular pay plan that we have here. Again, change is a little difficult. We have things that are 1C, 2C, 3C. The C, we're assuming stands for classified. It's just kind of there. You know, we could call it whatever we want, but those in the gray, we don't use those anymore. Those are ones that we have eliminated from an entry-level position at the city of Branson starts out at an 11C. And if you'll notice, that entry-level rate of pay is $16.46 an hour. That puts us about a little over $4.50 an hour above minimum wage. That was our target, to be able to get up that high. Because if we don't have that differentiation, we're going to have a very difficult time recruiting the entry-level positions. If we have a problem recruiting the entry-level positions, then we have salaried people working tremendous hours, and Cindy can attest to this, that it's so hard for her to get some of that entry-level help that she and her salaried staff are sometimes putting in 70, 80-hour work weeks. And that's the thing that we needed to target first and foremost, in my opinion. But that cascades up through the pay scale. Each step is an increase of 3%. And you see the entry-level rates and things like that. So that's just the overall pay plan. And Chad, if you'd scroll all the way down, and it goes down to a 44C. That is the top paying position with the city of Branson that is not in a department head or a director role. That's going to be your assistant chiefs and those positions like that. Okay, if you would pull up that next one, please. Self-servingly, this is the department head pay plan. We expanded that by one simply because it was compressed to a point where after we did our salary study, we looked at, you know, the different roles and the point accumulation that they got. They were so compressed that there was not a lot of differentiation, so we added one more level to allow for space for additional growth in there for department heads as well. And if you would then get the next one, Chad, please. Now this one won't go in the budget book. In the past, we had submitted something like this for the budget book, but this one has extra information that we don't need for the budget. I wanted to be able to show the difference between the 2022 pay grades and the 2023 pay grades. Some of those are going to be based on the salary study that we did with respect to going through and looking at the conditions, work conditions, and the effect on overall results, the latitude to make decisions and things like that. That all works together to establish a rate of pay for employees. We put that with our SAFE system that we talked about last time. And in doing so, I just kind of wanted to show what we had here with respect to all the different positions and where they were at with respect to their pay levels. The one thing, we've got a formula set up so that whenever an employee moves up a couple of pay grades or 3 or 4 or whatever that number is, we've got a formula set up to account for their number of years of service that they've worked here, so that if we hire somebody in immediately thereafter in that same level, that person isn't suddenly making more than someone who's been there for a while. So we put in that little gap there. In the same fashion, if a pay grade goes down, that employee does not lose compensation. We're not going to penalize someone. What does happen is if we replace that person, they come in at a lower rate of pay. And you know, there's a number of them in there, but essentially, you know, we had, in the past, we'd submitted these to be a part of the budget book. They haven't been since, I think, about 2018. And so we're going to reintroduce these for the budget book for 2023. Okay. And let's see. All right, now, Chad, if you would bring that next one up, I would appreciate that. You kind of had it there for just a second. Now, this is just a quick snapshot of the preponderance of work that Kimberly did. She went through and she performed an evaluation you know, right here in this snapshot, I got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 positions. She did it for all the positions for every employee in the city of Branson. She went through and she evaluated their skill level, their training and ability, their experience, their level of work, their human relations skills, their physical demands, their working conditions and hazard, independence of action, impact on end results, and supervision exercise. She went through every single employee and evaluated them and reviewed those with the department heads to develop a score by which we allocate the classification number for each employee. As you can see here, there were multiple ones that moved up on this particular snapshot that we've got, but she did it for every single employee. This is, again, that goes back to that SAFE system that I mentioned in our last meeting. That's one that Springstead introduced to us in 2016. Springstead was acquired by Baker Tilly, so that's kind of in the family, if you will, part of Baker Tilly. And now, if you would, Chad, bring up that last one. And these are the compensation guidelines. These are things that we're going to introduce and we're going to have as a part of the budget. But at some point, there's specific protocols and things like that that I want to make sure that we introduce into the Human Resources Manual so that we've got those criteria laid out. You know, we're talking about things like, you know, new hires are expected to start at the entry-level rate and so on. You know, those are the things that are not articulated anywhere, and they need to be. So we're going to employ those in the budget book so that we make sure that we've got those codified at least someplace, and then we're going to follow up and put those in the Human Resources Manual. So that is effectively the presentation for compensation. You know, the thing about it, the one thing I wanted to add is, you know, on the reclassification of employees, we met with Ben, you know, as the project was first getting underway, and we developed a budget with respect to how much it's going to cost to reallocate these folks into the new positions. As much as we'd like to give them full credit for their experience and things like that, we had to trim it back a little bit. We were given about a $300,000 budget, but we came in under that, so that way we're making sure that employees are appropriately compensated and that they're getting significant raises based on their kind of work that they do, for those that make significant shifts. You will see one employee that moved up 9 pay grades simply because of how somebody had envisioned that role before in the past, and we looked at it and said, this is nuts. You know, they should be, you know, their level of work is up here, their exposure to danger is here, let's increase it. So that's what we did. So anyhow, that's a presentation on compensation, and I'll take any questions you have.
Well, you've shared another mouthful. I'm going to start off by, I want to again publicly share our appreciation for Ben and Baker Tilly, what they bring to the table. I would also like to give Kimberly kudos. She's been working her little patootie off in preparation of taking time off with pay. Jen, I just heard you say you're retiring next year.
Maybe sometime. I'm not sure when.
Well, if you do, I've been here long enough to know that what you've accomplished in this past year is just absolutely remarkable.
Thank you.
The moving us towards that self-funded insurance has been talked about and talked about and talked about. And to see you able to put that in action, the entire city is going to benefit from those savings that we're talking about. And every employee is going to benefit. So that's huge. Moving the public safety from 21 steps to 10 steps, that has been talked about from day one since I've been involved with the city, and I'm sure much longer before that. So public safety, both police and fire, I've heard that come from them, that request come from them over and over and over again. And during your tenure, you were able to accomplish that. Huge. The salary study is second to none. What we've been paying our employees compared to what other municipalities are paying, it is no wonder that we've had a hard time recruiting. I mean, in every department, right? Or retaining. The increases from our salary study, I just think is huge kudos. And to see you accomplish those three things prior to your wine, fishing, whatever you do,
Beverages.
beverages, we'll just say beverages, not to compete with Coca-Cola or any of the majors. I just wanted it publicly for everybody to recognize what you and Kimberly have done in this past year. Just remarkable.
Well, thank you. I say thank you for my department, but actually, it's all of us working together. The thing is, I'm scared to death that Kimberly's going to be gone day after tomorrow or the next day. And it's like, crap, now what do I do? She has been rock solid.
Yeah.
I recognized her value several years ago. Honestly, when I first came on board, she was here, and I didn't like the way she was treated, and I fixed that. And so anyhow, she's blossomed into a major performer.
Mr. Mayor?
Yes.
Thank you. I really very much appreciate your comments, and I feel the same. The other thing I just wanted to say is how much I appreciate Jan and Kimberly's willingness to listen to the other directors. This was a really key piece because it was such a challenge for Kimberly to, have to sit and evaluate the staff, the job descriptions, which, use that scoring system, et cetera. But we do have a few unicorn-type positions. I've been referring to them in the city. And their willingness to sit down with directors and with the staff that was concerned maybe about a class that they were going to be placed into, and to do that with an open mind and to listen actively was really key too, to building that stronger relationship between all of the directors together. So I just want to thank you guys for doing that as well and having open hearts and open minds in those conversations.
Anybody else?
I just want to echo what they have said too. I know took a lot of hours of work for your team, and it's shown, and I think we're moving in a very positive direction and a direction that the city should have moved in a long time ago as far as compensation goes and reclassification. So
Thank you.
Anything else you want to share? Well, I think you're on a roll, Jan. You've given us some very positive, enlightening presentations. Do you have another one on the list for today?
I don't.
Wow, what a great presentation. What a good day for our city. Anybody in the audience want to share anything? No other comments from the committee? Hearing none, I'll entertain a motion to adjourn. We have motion and a second to adjourn. All in favor, say aye.
Aye.
Up, up, up.
He
did?
does have another one.
I think he wants to go out on a high note.
Oh, yeah, we've got, I'm sorry, somebody sent me an email and I should have read it. It's, when,
Gosh, we had a second on the adjourn.
oh, just that close. When it comes, when do we want to do that, next month? You better come up here and do this.
We had 2 wellness appeals that came in, and Jan had thought we could give them till November 1st as a grace period before presenting them to you. They submitted everything that was needed by November 1st, and we hadn't compiled all of the health and wellness tiers and decided all of those. So he thought we would probably, rather than waste everyone's time here, go ahead and approve those since they're all done and turned in. And so I just wanted to make sure that you all were okay with that. And if you are, then we won't present them. And if you would like to hear them, we can present them.
My personal opinion is I will follow Jan's lead. Any other opinions?
They did them, they completed them, they were late, and that's it. So it's like.
Shame on you.
Why ding them? You know?
Kimberly, thank you for bringing that up. Jan, you have full support.
Okay.
Thank you, Kimberly. Slow down. We need you here for a while. Walk slowly. We're back to our first and second. All in favor to adjourn, say aye.
Aye.
Pose same sign. Ayes have it. Thank you very